We are continuing our agenda with agenda item 5C on advancing public health in the WHO European region for sustainable development. The relevant document can be found in Euro/RC68/17. There is also draft resolution for our consideration in document Euro/RC68, conference document /10, and financial implication in Euro/RC68/17 add 1. Public health has been very high on our agenda in this region, and this discussion will give us an opportunity to reflect on the new and enhanced role that public health needs to play in the context of the implementation of the 2030 Agenda for Sustainable Development, in particular with reference to its societal function, which needs to involve everyone, everywhere, across government sectors and through all levels of the government. I would like now to ask the Regional Director to introduce this topic. Dr. Jacob, you have the floor.
Distinguished delegates, colleagues, ladies and gentlemen, I'm really very pleased to introduce this agenda item, and particularly our vision on public health and its importance to the Sustainable Development Agenda and the way how we promote health and public health in the European region as part of that development. This is not the first time that public health features on the agenda of the Regional Committee. In fact, I could say that the commitment to public health has been and will remain to be the hallmark of my tenure as a regional director. Public health is at the core of Health 2020, which is a public health policy framework. It is the foundation of primary health care, and it is a critical pillar of the universal health coverage and health services. Over the past decades, the European region has been leading public health in many ways, and a lot has already been done in the region in recent years, also through the implementation of the European Action Plan for strengthening public health capacities and services, and also the essential public health operations, which were adopted in 2012 by the Regional Committee. However, as we all know, public health is a dynamic concept which needs a continuous adaptation to the changing policy and the knowledge environment, to the emerging challenges faced by our countries, and to the interconnected complexity. This is why it keeps coming back to the Regional Committee agenda at regular intervals. With the Sustainable Development Agenda and the new WHO General Program of Work 13, it is very timely to bring all components of public health together under a unifying vision and reaffirm our commitment to provide political leadership along with more investments into this important social and public good. Public health is integral to implementing the Sustainable Development Agenda, our Health 2020 policy, and the WHO 13th General Program of Work. There cannot be sustainable development without a public health component, and cannot be health and well-being moved forward unless we really invest into public health. And unless we are able to secure the engagement and commitment of the whole of government and whole of society, there will be no real movement forward. Since we are in Rome, ladies and gentlemen, I wish to start with a reminder of public health meant initially in practice. This is the image of the ancient Rome sewer, the Cloaca Maxima, built approximately 600 years before Christ. Roman engineers were very good at building waterworks, sewers, roads, and spas. Probably they did not think they were doing this for public health. But in fact, this is what they were doing. Today, sanitation is still credited as one of the main contributors to the increase of life expectancy by over 30 years in Europe between the 19th and the 20th century. Since then, of course, our challenges have multiplied. In Health 2020, we have adopted Sir Atchison's definition of public health as the art and science of preventing disease, prolonging life, and promoting human health throughout the organized efforts of society. Public health, first and foremost, is the function of the entire society. It engages multiple policy sectors and across all the levels of the government. Public health is about prevention. It is about action on the root causes of ill health, addressing the genetic, environmental, social determinants, risk factors. Public health can provide mechanisms to promote intersectoral action, and it is also a function of experts who work inside and outside the health sector. As I keep saying, health is a political choice. When a Ministry of Finance agrees to taxation of tobacco or unhealthy food, this is public health. When Ministry of Environment reduces the emissions of air pollutants and greenhouse gases, this is public health. When a municipal council makes its city more walkable and cyclable, this is public health. Across the life course, multiple challenges make it difficult achieving health and well-being for all. Measles, which already affected 41,000 children and adults since the beginning of 2018 in our region, is a reminder of communicable diseases whose transmission could be effectively halted with immunization. And yet, it is still a threat. As some of you said earlier this morning, and I totally agree, that this shows the weakness of the public health system in those countries which are most affected. Migration calls for better preparedness to respond to the health needs of the migrants and the resident populations, taking into account vulnerabilities and human rights. Aging populations, if not managed well, can place heavy burdens on our health and pension systems. This requires welfare, labor, and social policies that ensure equity, intergenerational solidarity, and financial protection. These multiple challenges do not operate in isolation from each other. They are closely interlinked and call for action across the different sectors. For example, longevity contributes to the increase of non-communicable diseases. In the European region, approximately 1 in 4 ischemic heart diseases and strokes and 1 in 5 cancers are estimated to be attributable to environmental exposures. We cannot fight non-communicable diseases without also reducing exposures to air pollution and dangerous chemicals. Antimicrobial resistance requires a holistic and multisectoral approach because resistant bacteria arising in humans, animals, and in the environment may spread from one to the other and from one country to the other. Therefore, fulfilling our shared vision of health and well-being for all requires recognizing the necessity and the benefits of working across sectoral boundaries and breaking the silos. Moving forward requires that we significantly increase our investments in public health, correcting the misconception of health as a cost and just one of the competing interests which cry for political attention. We should not forget that health is wealth. We have plenty of evidence that investments in public health and primary prevention deliver great value for money. For example, for every dollar invested in immunization, there can be a saving of 27. And for every dollar invested in improved water and sanitation, we could save between $3 and $34. Investing in early childhood development, as we said last year at the regional committee, is estimated to produce a 17-fold return for each euro invested. A 10% reduction of cardiovascular diseases could save 20 billion euro per year in lower and middle-income countries. The cost of no action is significant. The direct and indirect costs of high disease burden in countries can consume up to 15 or 20% of the GDP, as we have seen in some recent studies. And please note that bad health is much more expensive for the societies than good health, or we can turn it around. Good health is much cheaper than bad health. Yet investments still fall short of what is needed. And we don't know what is the reason actually. Is it because prevention is not politically attractive, since it is mostly invisible? Or is it because the time it takes for prevention activities to deliver results do not always coincide with the government cycles? Or are there some other reasons? This region has a wealth of knowledge, experience, and capacities to make fast and significant progress. This is the region that championed pioneering concepts such as the health in all policies. This is the region that put public health into action, which is evidenced by our results. This is the region that has introduced also public health into the global agenda. And this is what underpins the documents and the draft resolution, with the 10 action points that you have in these action plans that we are submitting to you today to inspire and support even more and better public health action in the countries, both across all levels of government and across the government sectors. And let me just remind you of some of these key initiatives and action points that you find in the document in front of you. Above everything else, the plan calls for strong political leadership supported by solid and transparent governance mechanisms across all levels of government, bolted into the national development policies. This also requires institutionalizing multisectoral action by placing it under the leadership of the highest policymakers, for example, the President, the Prime Minister, the parliamentary committees, depending on the national institutional setting. This will need, of course, policy coherence and integrated approaches to move away from the silos. This will facilitate working across multiple sectors, increase the coherence of government policies, and provide legitimacy and a clear mandate to act. These commitments have to be followed by adequate resources and investments into public health, particularly to support prevention and the capacities of public health actors to act. To make this happening, we need to critically review the existing institutional frameworks, creating connections where missing, communication channels across sectors, and removing barriers where existing. In particular, more resources should be allocated to strengthen the capacities of public health actors inside and outside the health systems to be more effective advocates in a complex policy environment, focusing on new skills such as policy, political and strategic analysis, capacity to undertake health and health equity impact assessment, political astuteness, and influencing and negotiating skills. Engagement of relevant sectors, civil society, local actors and stakeholders, the general public, and where appropriate, the private sector, will be paramount to achieving consensus and increasing public support and ownership. However, appropriate safeguards need to be in place to ensure transparency and address conflict of interest, and this must include better management of the commercial determinants of health. To implement evidence-informed policies and to know whether our efforts are successful, we need to strengthen institutional capacities for the generation of evidence, health data, information, tools, and methods to support decision-making, implementation, and monitoring of results. This would entail putting in place a transparent accountability system for measuring efficiency and effectiveness of actions and progress through relevant indicators. It would also mean prioritizing public health policies for which strong scientific and practical evidence exists and cost effectiveness. This goes hand in hand with creating a new public health workforce, empowered, legitimated, and trained to act effectively in complex and multisectoral policy environments across all levels, to produce evidence to support decisions, and to utilize state-of-the-art methods and tools, including to communicate with policymakers and the public, and to monitor results. We also need investments to promote knowledge, health literacy, and social values to empower people to make informed decisions about their own health. Resources for this should be secured through social and welfare provision. Ultimately, however, we need to provide physical, societal, and commercial environments that facilitate healthy choices. This includes developing better understanding of the virtual environment created by the social media and their role in the context of health, learning how to capitalize on their openness, inclusiveness, and speed, while understanding how to effectively address the spread of misinformation of health interventions. WHO is with you in this endeavor. I wish to thank all member states, eminent experts, and WHO staff who contributed to the reflection and discussion which underpins the background documentation and the draft resolution which have been submitted to your attention. And from among our staff, I'd like to thank specifically to Nedret and to Francesca Raccioppi, who is not here with us today, for all their leadership to come forward with this document that is in front of you. Thank you for your attention and looking forward to a great discussion. Thank you.
Thank you very much, Regional Director, for a very interesting presentation. I would like now to invite a small panel to join us here and hand over to Dr. Roberto Bertolini, who will be our moderator this evening. Please.
Good afternoon to everybody, and I would like to invite the panelists here. Mrs. Taru Koivisto, Director of the Ministry of Social Affairs of Health and Well-being in Finland. Dr. Vesna Kertlin-Petric, Head of the Division of Air Promotion and Non-Communicable Disease at the Ministry of Health of Slovenia. Rosemary Kulwenda, Regional Team Leader of UNDP in Istanbul Regional Hub. Dr. Dineke Ziger Paget, Executive Director, European Public Health Association, and Professor Ilona Kikbush of the Graduate Institute of International Development Studies in Geneva. So, first of all, let me say that it's a very big honor for me to be here today and to coordinate the discussion in this important session. And actually, I enjoyed the presentation of Susanna, which touched very clearly a number of the issues that we have to discuss and to apply. And I would like to emphasize that the definition that she showed, the definition of Sir Donald Acheson of public health, is actually a definition of 1988. So it's still valid today, very much valuable. But we need to adapt the application of this definition to the evolving times. And Susanna has mentioned some of those issues. And if you think about it, in 1988, there was still the Berlin Wall. There was no social media, no internet. Public and science did not possess the sophisticated analytical tool that they have today. Big data was not an issue. And just to mention a few things. So, and also the understanding of the nature and the determinants of many diseases improved dramatically over the last years. And also the identification of the very complicated interactions between different elements, between development, environment, social conditions. And we as public health professionals also, and the public health as a discipline, we need to understand and adapt to this changing scenario. And we need to explore new territories. We need to be able to know more on governance, of social science, of diplomacy, economy, and learn also how to interact with these other disciplines and to be able to do it in a positive way, breaking the silos as we often mention. And we have today an impressive panel of colleagues who have been working in this area for many years, and they can share with us some of their experience and their knowledge. And I would like to start with Taru. We have about 40 minutes, I think, for the entire session, and so I would like to have a couple of rounds of contribution from each of the panelists. And by the way, it's an all-female panelist, so I'm a little bit impressed by this. And then we have also the space for some questions or remarks from the audience that would be very useful to have a conversation on these important issues for all of us. So, Taru, you come from a very important country who has developed the concept of health in all policy in practice. So, and we know how important it is to engage other sectors in public health, addressing the root causes of ill health. Can you share with us some of your experience and tell us how you actually managed to do this?
Yes. Thank you. Thank you for this opportunity to share our experiences in health in all policies. Public health and health in all policies approach and cross-sectoral action have been, in some forms, high priority in Finland for a long time, since 70s already. And also reduction of inequalities. It's already now also included in our current government's program, so it's a really high political priority. The concept of health in all policies was launched 2006 when Finland held its first EU presidency. And after that, we have actually used the broader concept, health and well-being in all policies, just recently. In Finland, the municipalities have been forerunners in implementing health in all policies approach, and it has been a legal obligation in municipalities since 2010, so several years already. And there are very good practices about working across sectors on local level. And we already have some evidence also that legislation is supporting this kind of broad approach and systematic work on local level. And I especially want to mention that we have a law, but before that we developed the tools and the contents of a law together with municipalities. So we didn't draft this directly in the ministry, but we did it together. And because the municipalities in Finland, they have broad responsibility of almost all services, so it's a very good basis for health in all policies approach, practical implementation. So what does this mean in practice, health in all policies in municipalities? There are several issues included in the law. One is cooperation, which is a duty, multisectoral cooperation and working with NGOs and other actors on the area of a municipality. So that there are multisectoral groups which together take care of practical implementation of activities. And it's not just social and health sector, it's all sectors of municipality together and also other partners which are needed there just to find the way to work together. And the duty of a municipality is to monitor also trends and health of well-being of the inhabitants by population groups, and also all the factors which are influencing health and well-being. So as a basis for planning and management of services, they have information about the situation. And they need to develop a well-being report every year, present it to the political decision makers, and every 4 years they in municipality prepare a broader report so that it's possible to include it in a planning and management of activities in a municipality, not something separate, but as a part of activities there. And an electronic version for that is used in almost most municipalities. So the data is a very important part, and in a way creating also the commitment of the politicians to have this data available about also the activities which they have done, how good outcomes there are. And then prospective impact assessment is used in municipalities as well. It's by law also. That's something, an area where we need a lot of improvement still. It's not easy to do that, and so we support municipalities there. It's not always necessary to have very broad analysis. Sometimes just a checklist is enough, so that we are trying to support the municipalities. So that this is an example from a local level, and very much of these elements are such which could be used on national level, and we are trying to implement these also on national level, and in addition to also try to put these forward also in international and global level, so that we need these elements. We need data, commitment, monitoring, we need permanent structures and processes which create the opportunities for practical implementation of public health measures and health in all policies implementation. And therefore, we think it's also this kind of experiences from our country and other countries as well could be used while implementing the Sustainable Development Goals. It's an opportunity to put forward the health in all policies approach and use this approach. It's not just health services, it's a broad area of all the goals of Sustainable Development Goals where we can have this approach and can utilize also the opportunity to find partners for broad-based activities.
Thank you, Taru. This is very interesting. I like very much this, the way in which you presented it at the local level, because this is probably one key factor, and also this issue of reporting and documentation, which I think is a critical issue that sometimes, I mean, we all recognize it, but it's a very difficult domain. Ilona, I would like to turn to you, and you have worked a lot in the last years in issues such as governance, health diplomacy, and this, you know, in a sense, has allowed you to be more directly in contact with people who are not directly from the health field. So I would like, can you tell us what you have learned from this process? I mean, which kind of lessons you have got for expanding the public health competence to other sectors? And do we have the right tools to engage these other people in this conversation and action?
Thank you, Roberta. I think what I've learned and what I'm learning more and more is actually the extent to which public health is always within those crossroads of power and politics. And that we have to be prepared. Susanna said again, health and public health is a political choice. We therefore have to be prepared to negotiate political choices and to convince people to make those political choices. We have found that obviously data is important for that, but it's not only health data and it's not only economic data. We have found that we think that if we bring the economic argument, we will win. We have to combine the economic argument with a whole range of other political arguments in order to convince political decision makers. And therefore, if we speak about the evidence base that we bring to the table, it's also an evidence base that actually not only speaks of the health gain, the economic gain, but it also has to include, in a sense, if I can call it that, the political gain. Political actors have political interests. We have to do an analysis, therefore, also of the political interests. Sometimes it's called a stakeholder analysis, you can call it a power analysis or whatever. Because most of the things we have to deal with, if it's tobacco, if it's sugar, if it's water, if it's vaccination, I mean, the list is endless. There are interests that work against health. And therefore, we have defined health diplomacy as the ability to negotiate for health in the face of other interests. Now, in some cases, you can actually do mutual gain negotiation. That is, with another sector, you can show, if you help us, we help you. If I invest in education, we get something, you get healthy children, back and forth. That works sometimes. But increasingly, I think, in our societies today, mutual gain negotiations are very, very difficult. And we actually have an enormous strength. The regional director mentioned the commercial determinants of health, that in a global consumer society, the forces against health, and these forces impact on politics and politicians and parliamentarians, are very, very strong. So we have found it needs a different type of skills training. How do I deal with these interests, these very strong interests, and not get discouraged straight away? They have much more power than I have, therefore it's no use. It's also an ability to actually speak and be credible with decision makers. And that also means you don't only go to them when you have a problem, you actually build relationships over a long period of time. You know how to make it tangible. And we have found in the past that, making it tangible in terms of settings like healthy schools, etc., can be very important. But throughout it, the framing and communication of the issue and the political gain it will bring is absolutely critical. We don't always feel good doing that because we are used to a different kind of evidence base. We want to stick to our data and say, this is really where we are. But we are finding, look at the vaccination issues we have discussed. We were not prepared for that counter movement. We are not prepared for the emotions that are now being brought into the public health debate. We are not really prepared well for the counter communications that are going on. And I think this is where we really have to work and where we've been able to gather some experience. We've put some of those into the training manual we've developed. But I think we still have a major challenge. And at this point with social media, I think that challenge is becoming even larger.
Thank you, Ilona. You touched some very important issue. I think one concept that you have touched is mutual gain. is something that we often don't think in this respect. I mean, sometimes I have the feeling that we approach the problem of health in all policies or the involvement of other sectors under a sort of ethical frame. I mean, this is right, so you have to do it because it's right. But I think, the mutual gain also in view of there was something that Susanna said in the introductory speech when she spoke about health as a measure of success of the government as a whole, which I think is something that we need to stress more in different countries also. I mean, to show that the health has improved. It's a measure of success of the overall governmental action, not just of the health sector. This concept maybe, and the framing issue is also very important. Rosemary, I mean, I wanted to, you come from UNDP and you are very much involved in SDG implementation. We have seen all the interactions between SDG and Health 2020, public health, and so forth. And you talk very often, I guess, with the environmental, energy, agricultural sector. So you are in touch with the others, right? So do you feel the other sectors actually are aware of their impact on health? And are we providing them the right information? I mean, Ilona was touching this indirectly, but I mean, I would like you to expand a little bit on this concept. How do you find the other sectors with respect to the health and the public health issues?
Thank you very much, moderator. First of all, I think let's backtrack a little bit and talk about how we support countries to domesticate SDGs. And this daunting task has been one that the UN has embarked on with a lot of vigor. So UNDP, in a sense, has initiated that dialogue at country level to ensure that countries own the process of domesticating SDGs through a process that is called mainstreaming, acceleration, and policy support at country level. And so these processes are nationally led and usually co-chaired by the resident coordinator and a government institution that sets in place or puts in place a mechanism for nationalizing the SDG targets and indicators. So in integrating SDGs at national level, that institutional mechanism requires a lot of interministerial collaboration. Mm-hmm. And we've seen the birth of national institutions that ensure that interministerial committees are set up for SDGs. And this is the place where the negotiation actually takes place, how the health sector then provides the evidence for the discourse that will ensure social, economic, environmental determinants of health and health equity are integrated into larger national policies and development processes. We have examples of how some of the UN big programs that deal with the environment, for example, Global Environment Facility, we sit at the table to ensure that we provide evidence that global environment facilities support to health programs provides a public good. Mm-hmm. So we have examples of global environment facility projects that are focused at ensuring elimination of mercury, for example, from the health sector. So such projects then are taken up by countries to scale so that we eliminate mercury, which has harm not only to the people, but also to the planet. So I think integrating those 5 Ps principles of securing the gains for people, for planet, and ensuring that there is peace and partnerships, it's through domestication of SDGs that we see interministerial action across sectors. We also, within the UN, we have had to introspect and ask ourselves the question, are we doing good internally within the UN? Mm-hmm. And to a large extent, we have tried and we negotiate to ensure that we put in place our own inter-UN or inter-agency mechanisms for mutual accountability. To that extent, we have the leadership of WHO in issue-based coalition on health, and other sectors also have issue-based coalitions. But the health coalition on issue-based coalition on health is one of the most active issue-based coalitions. And this coalition, for example, has developed a common position on ending HIV, tuberculosis, and viral hepatitis in the WHO European region, and this will be launched in New York at the high-level meeting. So we ensure that we mutually can account for what we do jointly as the UN in integrating health in the larger development discourse. And further, we also look at our own examples of how we identify our practices within the UN and how they impact on the planet, and also our own delivery of health services. So in that regard, we set up what is called an interagency task team on sustainable procurement, because we realized we have a market power of close to $5 billion of procurement. And if you look at overall procurement in the UN, almost 80% of all procurement is health procurement. And so we need to look at our own carbon footprint. As health actors, are we communicating with non-health actors that the health sector also needs to do no harm to the environment and also to protect people? And lastly, we also need to know how to communicate effectively on the larger impact of the health sector, and we do this through different perspectives of looking at the larger public health, environment in general, and other such impacts that may be arising as a result of our action or inaction in the health sector. So to a large extent, we do have challenges, just like any other sector, but I think the issue of negotiating our space is important. And I think we do that. It's quite difficult, but we are showing strides that without health, there can be no attainment of SDGs.
Thank you. I find very important this concept of looking in our own domain and decrease the impact on the environment, for instance, of operations of UN. I think it's an important thing. We have been doing that also in WHO for a number of years, but still not close to the objective, I think. Dineke, you are representing here a very important professional organization, the UFA, which organizes every year an important conference, and so you are in contact with the research community. And from your perspective, by looking at the abstract, at the speeches, do you have a feeling that people are expanding the remit of research and investigation to cover issues such as intersectoral work, economic evaluations, governance, and things like that? Or we are still far from this and we are continuing to do traditional studies in areas that are, let's say, more reassuring, like, I don't know, lead, which I heard from a colleague some time ago that when looking at chemicals study, lead continues to be one of the most studied issues where we probably know not everything, but many things. So what is your feeling, your experience in this respect?
Roberto, thank you very much for inviting me. Yes, I represent a public health association, so the public health workforce, not just researchers. But you're right, our conference and our scientific journal are mainly aimed at research. And I can tell you, the research is of good quality and good quantity. But as our regional director said, we need to continue investing, and especially in collaborative research. There are some buts. You asked the question, do we go beyond the field of public health? We only recently started working beyond the field of public health. I'm a bit ashamed to say that. But now we're working with architecture and health. We're working on law enforcement and public health. We're working on, obviously, environment and urbanization and health. So we're going in the right direction. The big but is that researchers need to be much better in knowledge translation. As Ilona already pointed out with health diplomacy, we need to learn how to be able to talk to policymakers. We've taken some steps. We have at our conference key messages. We have our plenary sessions and our workshops aimed at policy and research together, seeing how we can move forward. We also have in our journal that you put key points for policymakers, so they don't have to read the whole article. You're free to do so. You don't have to. You can read the key messages and see what is important. But a long way yet to go. So what is missing? And Ilona mentioned a lot of the issues I wanted to raise already. I think it is very important that we continue to build the skills of the public health workforce. I'm very pleased to see so many and very active student associations here, very committed to health and to public health. So I thank you all for that. I also think it's very important that we first build the skills of existing public health workforce. So we have to have skills building activities during our conferences, but also outside of our conferences. We also need to work with the schools of public health and with medical schools, pharmaceutical schools, physiotherapy schools, to train them how to talk to policymakers, to train them how to talk to other sectors. So we need to facilitate the exchange and the dialogue between research and policy. Ilona said most of it, so I will keep it short. I will just finish with the public health workforce need to step out of its comfort zone and step up to this challenge. Thank you.
Thank you, Dineke. Thanks a lot. I fully agree with you, actually. I couldn't agree more. And Vesna, I mean, I know that you have a very interesting experience in Slovenia, you know, in which you link, let's say, the public health action and the primary healthcare level. And why don't you tell us something about this? Well, as an example of new public health, let's say.
Okay, I will start by referring to what Susanna has said. She said that public health is so many things, and really it is enormous. And when I was listening to all of you, I thought, my God, I have a new minister. How am I going to explain to him what he has to do in public health? Everything? He came 3 or 4 days ago, I mean last Friday, so it's maybe more, but I will be approaching him next week and I have to say something. So I thought I will show him this book. This book is really big, so he would understand that it's something big behind it. But
you can bring a dictionary, something.
But you see, the title and the blogs there, and I hope you have all looked at this book, tells you so much on one page. It says health systems respond to non-communicable disease, so we focus a little bit, leave out environment and all the rest. And then it says time for ambition. To say ambition to a minister, it's always good. And then there are blogs, and it says aligning policies, intersectoral action, integration, and so on. This is everything I want him to focus on. And when I show him this and we'll discuss a little bit, he will most probably ask me, yeah, but how are we going to do this? And I will say, we are lucky. We have done a lot in the previous mandates. They don't really want to hear this, but, you know, because they want to hear, they will do everything themselves. But I will tell him that, you know, what has been done was done because we got quite a lot of money that we have to spend in his mandate. Things were started in the previous mandate, but the spending is in his mandate. And the money was actually, we got the money through the cohesion funds. We got 26 million to be invested in primary health care. What is this money going to be for? Well, it's going to be exactly for, you know, tackling non-communicable diseases better. And the next question will probably be, who is going to do this, you know? The money is there, so we have the money, but we need somebody who is really going to deal with it. And I will say, I'll surprise you here, because it's going to be public health, but it's also going to be primary health care. They're going to work together. And I don't know how many of you know that very recently there was a very nice workshop in WHO where we met public health professionals and primary healthcare professionals and discussed how we could better work together. And yes, we realized that this is difficult, but it's possible. And we are making sure in Slovenia that this will be possible. What are we going to do? In primary healthcare centers, we are going to establish, or we have already created, health promotion centers. These centers will serve the physician and his nurse to tackle the risk factors better, because the physician and the nurse can counsel the patient individually, but then we leave to the patient that he goes home and takes care of his problem. And most of the time this is unsuccessful. He's coming back and back with his problem of smoking, obesity, and so on. The health promotion centers now will be there for the primary team to refer the patient there, and there he will have smoking cessation counseling. They will approach his obesity and so on in a group or maybe even individually. And that is not all, because what we have realized is that it's very easy with patients who come to the doctor and are willing to discuss their problem, but there are plenty of patients out there who should be considered as vulnerable groups that don't apply for these services. Either they don't know about them, or they think, no, it's not appropriate for me, or something else. So we are now combining these centers are going to also work with the district nurses and the social services and a local community as such, to bring in also the vulnerable groups into these services. And this, I think, is really important, because the aim is to reduce inequalities, not just to tackle the risk factors, but to, at the same time, look at inequalities. So we are doing this. I mean, we have published, WHO was very kind to us, and we have published this as a good practice, so everybody can look at it. It's on the web. But I hope my minister will be very happy, but this is not the end of the day, because my question then will be, you know, we have these 26 millions, but this will cover the expenses only for a couple of years, and then the Commission and its funding is going to back. So can you help me to get this into the system? We have to think of sustainability. There are so many wonderful projects around, and they fly, but then the funding is not there anymore. So, you know, it doesn't work anymore. And this is my major problem at the moment, to assure that this will be sustainable, not just through financing, but also for assuring training for professionals. And I'll stop here because I could talk for all day, but we are all tired.
Thank you, Vesna, very nice. We have only a few minutes, so do we have one question of 1 minute for the panelists? If not, I have some questions for the panelists. And the first is for Taru. Can you give some advice to Vesna about your experience and what she can tell to her minister, I mean, on nutrition, for instance, that you have such a large experience on nutrition? Maybe they can benefit from how to use this 38 million.
Yeah, I could also use the whole day for that, because there's so much to take into account and what you could use there. So taking the broader approach, health in all policies, and how to have this, to have other sectors and other partners supporting your activities. So I think it's good to create some kind of commitment and also vision, long-term vision for your minister. Usually they are thinking only for 4 years, but to try to have this approach as well. And data, it's really, which already was raised by several of the panelists, so that you can show what the situation is. And for example, in the area of nutrition, where are the places where you could have influence, and what are the problems, and what are the trends? And then what was emphasized with several others as well is the skills and expertise of people working on your own area, but also other sectors, so that they have also knowledge about public health and what to do and also health literacy, something which is, I think, the literacy of politicians especially. So they are not illiterate, but however also support that they can also analyze the data and use it in a good way. And so on the area of nutrition, I think in Finland we have a long-term work on that area. And what's essential there is to get all the important partners to work together and understand why to work together. So, for example, we are trying to tackle obesity, and there we need not just health and social sector, but also education system, food and industry, media, urban planning, non-governmental organizations, and communities, workplaces, all these, to understand their role, how they can support the healthy choices of people. And that's not always easy, but if we have good arguments and good advocacy skills to take this issue up, I'm quite sure experience from Finland shows that we can do something, but you need to have a vision what to do and what partners you need there. For example, in Finland, the school as an environment provides very good opportunities for healthy nutrition, because we have already for 60 years free school meals for all children every day, and that's something which creates opportunities for learning and well-being of children. And in schools they provide health education, they provide cooking skills and nutrition skills. We don't have vending machines at schools. These are somehow self-evident issues, but not always. And also, we have cooperation with NGOs, so-called better choice symbols, which have been used for a long time, so that in shops people can easily see which options are healthy, and also these marks are used in mass catering places. So there are a lot of very concrete examples which can be used, and I'm quite sure we can share. We have very good examples in all the European countries, which we could share. And because of that, I want to especially mention the role of WHO Euro here. They have created this coalition of partners for public health, which is an excellent example how we can share, learn from each other, develop new ideas, and have also learn from mistakes.
Thank you, Tara. Thank you very much. And we have very few minutes, and I would like to expand a little bit on the nutrition part. And it takes me to the commercial determinants of health that Ilona was mentioning before. While preparing the presentation some time ago, I found out that Coca-Cola was actually investing $3 billion per year only on marketing of their products. So this is just fighting against a giant, right? I mean, so I was wondering how we can contrast this on one hand. On the other hand, try to make some influence on this and try to change a little bit the situation. Also considering what you said before, the political gain. I mean, how can we be convincing on the political gain in front of these giants with respect to the counterparts at the political level? A difficult question, I know, but I mean, just...
Well, I'll try. I mean, we always need to find levers for change. And, we love to speak about the Broad Street pump and the handle. And we've started to think much more systematically whether investment is actually such a handle. And where the notion of actually addressing investors, particularly institutional investors, pension funds, insurances, etc., where they are putting their money for gain, which in turn, pays pensions and insurances and whatever. And there's been a fascinating move to actually move to divestment, for example, from tobacco. This is also going to be presented next week at the UN high-level meeting. And there are additional movements now to actually address shareholders, to address citizens, to say, have you ever asked your pension fund where their money is being invested? Do each of you know, have you ever asked that question, whether your pension fund invests in tobacco, for example?
Yeah.
So there are new levers that we need to work on, and it's not just companies anymore. It's really the notion of institutional investors. 55 in the United States, 55% of the food processing industry is owned by institutional investors. So if we find a handle to actually shift things here, as citizens, as consumers, as patients, we will really see something moving, and we will be able to affect change.
Thank you, Ilona. Rosemary, I mean, do we know where the money of the UN pension fund goes? We don't, probably.
I have no idea. I wish it goes to health.
Yeah, I mean, I just wanted to ask you one very quick question. I mean, about this, walking the talk within the UN. You have some figures which tell us, I mean, if this has been working. I mean, these procurement issues that you just mentioned before.
We're a bit of a latecomer on the procurement front because we only started around 2012. But in a short space of time, we have demonstrated that it is possible to engage with manufacturers and suppliers of health commodities. And thanks to some of the donors in this room, especially CEDA Sweden, they have provided some resources for us to interact with manufacturers and suppliers of health commodities. I like the fact that on Monday, when the Director General of WHO talked about the FENSA, he was saying, look, let's find a way of communicating with manufacturers and suppliers of health commodities. And the heads of our agencies actually signed a joint statement, which for us becomes a high-level tool for engaging with manufacturers and suppliers of health commodities. First of all, to show that there are gains on both sides. Mm-hmm. We need to ensure that we can all be talking about protecting people and planet. So if there's no responsible manufacturing of supplies and medicines, manufacturers on their part need to play their role ensuring that they can protect the planet and the people around them. Mm-hmm. And we have so far managed to secure a slot next year to talk to manufacturers in Hyderabad, mm-hmm. In India, because we have now a possibility to do so. And there are some manufacturers who have come forward and said, look, we need to find a way of having a tool that will help us to see where we are in our own baseline of manufacturing process. Yeah. And so that's a tool that the UN jointly, we are working together, and also engaging with manufacturers at the measurement of pollution or energy efficiency in manufacturing, polluting the environment can be measured. And so we're happy that we have a platform that assures that interaction to take place.
Thank you very much. Just a couple of minutes left. I mean, Dineke, you mentioned about the schools of public health, and do you have any example of the schools of public health which are actually expanding their programs and, to introduce these different skills, communication, governance, and diplomacy?
I think actually most schools of public health are currently working on new programs to include how to advocate, how to talk to different sectors, how to present your results on research. So we're moving forward.
Okay, thank you. Vesna, last word. Do you have enough now for your minister after this panel?
Yes, and I would mention one thing in addition. Ilona Kickbush, she referred to the difficulty of dealing with all the lobbies, and that is also something we are doing, I think, quite well in my country. We discussed with the Minister of Finance that we need earmark tax, but that was not what happened. But because we were telling Minister of Finance that, you know, we can get just rising a price of cigarettes for 10 cents, we can get 60 millions. When we started to talk millions, she at the end said, okay, I'm giving you 4 millions every year, and these 4 millions will go for NGOs and building their capacities, because without advocacy locally and at the national level, but even internationally, and without investing in this sector, so civil society, so that they are competent, we, I think, won't be able to reach our goals.
Thank you, Vesna. Thank you all the panelists. I think it's been a very interesting conversation, and I will give back the floor to the President. Thank you.
Thank you very much for a very interesting discussion. Now I am inviting those member states wishing to take the floor and to raise their name flags. Please, feel free. We have 15 minutes left. Poland, please.
Thank you, Mr. President. Colleagues, Poland would like to thank the Secretariat for the report Advancing Public Health for Sustainable Development in the WHO European Region. It is a very complex and informative document. We appreciate the clear division into challenges, opportunities, and proposed activities. While planning any health activity, we should always bear in mind that raising awareness on how to live a healthy life, sharing knowledge on healthy choices as well as preventive actions, mainly early diagnostics, should be the very first thing to be planned and financed from public funds. Such actions cannot be taken only by the Ministry of Health. They need very wide and intense multisectoral cooperation. In Poland, in 2016, the Public Health Council was established, as well as the Steering Committee of National Health Programme. The first body comprises of deputy ministers, representatives of academia, non-governmental organizations, employers' associations, and others, to have multi-stakeholder perspective on public health policy. The Steering Committee, on the other hand, is responsible for seamless introduction of National Health Programme by different public institutions. The National Health Programme 2016-2020 is the first nationwide program with earmarked budget allocated to each year of its implementation. It includes many projects in each programmatic area, currently with a total number of over 600 initiatives funded from the central budget. In order to improve the accessibility and quality of healthcare in Poland, last year the Act on Healthcare Services financed from public funds has been amended to gradually increase the financing of healthcare up to the level of 6% of GDP in 2025. Both the adoption and implementation of the National Health Programme, as well as the envisaged increase in healthcare spending, reaffirm political commitment to multisectoral cooperation aimed at advancing public health and attain Agenda 2030 goals in Poland. Let me conclude by saying that we support the resolution. Thank you.
Thank you, Poland. Austria, please. Austria, please.
Danke, Herr Vorsitzender.
Thank you, Chair. Austria wishes to applaud the initiative that has been taken by the regional director on the issue of advancing public health for sustainable development in the WHO European region. The document on this matter lays a very sound basis for further thought and certainly is a good starting point for our discussion. We have to think also about how we can integrate the goals of the 2030 agenda within all that we do. We know that there are major public health challenges to be faced, and now within the 10-point plan we have tangible ideas as to what the European could do in order to achieve the goals that have been set. We wish then to express our support for this 10-point plan.
The member states, I'd like now to move to the observers and the NGOs. First is the UNFPA.
Thank you, Mr. President. Madam Regional Director, on behalf of UNFPA, I'd like to congratulate WHO for developing a forward-looking document aimed at accelerating the Sustainable Development Agenda. The SDGs, first of all, prioritize the needs of those who are left behind. Therefore, comprehensive, people-centered public health approaches are critical for addressing inequalities. Making the case for investing in public health, the document calls on member states to ensure higher impact by preventing disease, promoting health, and empowering people. Investing in public health is critical for every country, regardless of the income status. It is an investment in the future of the countries and entire region. The new report of Guttmacher-Lancet Commission, welcomed in joint letter of WHO Director General and UNFPA Executive Director, provides evidence-based recommendations for achieving universal access to sexual and reproductive health by investing in public health. This is key not only for achieving universal access, but also for accelerating progress towards achieving the SDGs. We believe the upcoming conference, global conference marking 40 years anniversary of the Almaty Declaration, will result in renewed commitment of member states to invest more and to achieve more. As we are gearing up towards marking UNFPA's 50th anniversary and reviewing the progress achieved during 25 years since Cairo conference, UNFPA is committed, together with its partners, to deliver on 3 transformative goals by 2030: zero maternal deaths, zero unmet need for family planning, and zero gender-based violence and harmful practices. These goals are achievable if the investments are made in public health in line with 10 action points recommended by WHO in the document. We believe we can make these ambitious goals a reality for all if we join efforts, increase investments, and focus on comprehensive, impact-oriented public health investments. Thank you very much.
Thank you. Now we have only 7 minutes because 6 o'clock the interpreters will stop interpretation. That's why we have from the non-state actors 5 requests for the statements. Out of the 5, 2 are the joint statements. Maybe we can limit with the joint statements if you allow us, and then the others could be in writing form. On the web. First joint statement is from the World Organization of Family Doctors, World Federation of Occupational Therapists, European Forum for Primary Care, Council of Occupational Therapists for the European countries, Studiorum Medicus Mundi, International Healthcare Without Harm. Please, you have the floor.
Thank you, Mr. Chairman. Madam Regional Director, esteemed delegates, ladies and gentlemen, we welcome the document on advancing public health for sustainable development in the WHO European region. We would like to draw your attention to overdiagnosis as an important public health matter which turns people into patients unnecessarily. Overdiagnosis decreases the quality of healthcare, puts patients at risk of harm, overstretches health system, is costly, and undermines population health. Overdiagnosis does harm to healthy individuals and steals resources from those who need medical care. Overdiagnosis can lead to overprescription and overmedicalization, increasing the release of pharmaceuticals into the environment and contributing to AMR. Overdiagnosis may occur through overdetection of conditions that will never cause harm or death. The expansion of the definition of a condition, for example, can lead to overmedicalization of ordinary life experiences such as sadness, fatigue, and insomnia. Actions must be focused on several areas simultaneously. We urge the member states to, first, address the healthy public through global information campaigns on the unrealistic expectations about what modern medicine can deliver. Second, introduce new approaches in the education of health professionals who must be trained to deal with clinical uncertainty. Third, provide political support to all health professionals to reduce over-reliance on health assessments and interventions and curb defensive medical practices. Fourth, reform screening systems which do not improve overall mortality while causing patient anxiety and harm. Fifth, eliminate financial incentives which promote over-treatment and over-detection rather than improve patient outcomes and safety. And finally, manage the role of commercial interests in overdiagnosis. Thank you.
Thank you. The next joint statement is from International Federation of Medical Students Associations, EuroHealthNet, European Forum for Primary Care, Healthcare Without Harm, European Alcohol Policy Alliance, VEMOS, Medicus Mundi International Alliance for Health Promotion. Please, you have the floor.
Thank you. Honorable Chair, distinguished guests, all co-signers organizations of this statement are passionate change makers who are committed to health for all. Together, we are strongly committed to promoting public health as a key to obtain sustainable development. We believe public health should be addressed through a holistic, people-centered and lifelong approach stretching far beyond the health sector alone. To tackle major challenges such as non-communicable diseases and mental health, a shift in our approach to public health is necessary. Firstly, we emphasize the urgent necessity to undertake a transformation of our health systems. A preventive health model that addresses upstream determinants of health is needed. In order to achieve this, we urge the member states of the WHO European region to rely on sustainable and prevention-oriented primary health care. Secondly, we reaffirm the need for a health in all policy approach that recognizes that the determinants to health rely on many interlinked sectors. A holistic approach of every population group remains impossible if an intersectoral approach is not adopted. Thus, we strongly support the second point of the action plan, encouraging member states to adopt consistent strategies across all sectors. Thirdly, climate change and planetary health are an example of highly interlinked topic with a major impact on public health, considered both as the biggest threat and opportunity for public health in the 21st century. It is of utmost importance that we take joint responsibility to make sure that we build resilient healthcare systems and that the health workforce is sufficiently prepared to face this new challenge. Furthermore, the healthcare sector, as a major source of greenhouse gas emissions, both in its operations and supply chain, should reduce its own carbon footprint and lead by example, also educating staff and the public while promoting policies to protect public health from climate change. Lastly, the education of the future and current health workforce should strive to create a generation of aware, fit-for-purpose and skillful change makers whom society can rely on to further advance public health. This is why we strongly recommend the youth of every country to become involved in every step of the way. Nothing about us without us. Thank you.
Thank you very much. Then as agreed, the other 5 statements from non-state actors will be uploaded on the web. And now I'd like to ask Regional Director to respond to questions and comments.
Thank you very much, Chairman. Ladies and gentlemen, first of all, thank you very much for your support for the document, for the 10-point action plan, as well as for the resolution. I would like to express my thanks also to the experts who have worked with us throughout this process and helped us to come out with a punchy, streamlined document which provides clear policy recommendations. And big thank you also for the panelists for the interesting discussions. Of course, in Europe, we are always demanding and we want to have more than what we have, but let's face it that we have made very good progress in recent years in many of the public health indicators, as I have showed on Monday in my first initial speech. But of course, we have a large number of challenges. The agenda items of this regional committee are very closely integrated and interlinked with each other. Obviously, this item on public health is linked with the health system package that we discussed yesterday, and I would like to particularly point out the work that has been done on health systems for better NCDs. If we move forward to implement the ambitious recommendations that we have all agreed on, that will help us to scale up the implementation of the best buys, to speed up the implementation of the best buys, and also to integrate many of the public health actions, NCD actions, with that of the health system approach. And there are many low-hanging fruits in that regard, as we also discussed in CGS. So I think that we have a very good plan ahead of us to move forward. We just have to internalize more the recommendations as we discussed yesterday. And with this leapfrogging approach, we have a huge potential. The other issue I wanted to raise is that today we also discussed the European Public Health Report. This is not just a European report. We have a national data set behind it for every country. We know very well what are your challenges at the country level, what is the progress, what are the challenges. We always use it when we visit your countries, when we develop CCSs or bilateral collaborative agreements. So this data set will help us also to move forward, because this European Public Health Report serves the purpose to monitor, in the spirit of accountability, the progress on the indicators that you have set up for us in 2013 to monitor the Health 2020. So we do it very systematically, and that will also help us to move forward. The third issue I wanted to flag up is what Rosemary has said in the panel discussion, and thank you, Rosemary, for that. She highlighted the importance of this so-called issue-based coalition for health, which is basically bringing together the UN family around different sectors, different sectoral issues, including health. And on the health front, we have really made good progress. And there are 4 major areas here. One is TB, HIV, the second one is MCH, the third one is to access to medicines, and the fourth one is migration and health. And we are working jointly in an intersectoral and interagency mode, bringing in also the civil society into this work. And this gives us a very good hope, and it's a good entry point also for us into the whole UN reform, because it shows the strength of the UN family working together and moving together. And the final point I want to raise is what Ilona said in the panel, that health diplomacy is absolutely key here, and we really need to build new skills, new negotiating skills, particularly for areas which are so difficult politically, and where she said that there is a kind of interface between power and politics, which are the commercial determinants. And I fully agree with her that these are the diplomatic negotiating skills that we need to build among our health professionals and public health professionals as well. And therefore, all the work that is done in the region by Ilona, by others, by all of us, to build new skills within the health diplomacy work, it is very important, and that is the way for the future. But of course, political commitment will remain at the forefront, and the whole intersectoral mechanism, like Poland has pointed out, and I was very pleased to hear the Polish experience. I know that many of you have similar experience. That is vital. And I think that we have a very clear agenda now, and as Austria pointed out, this is a good start, and obviously we have to come back to these issues at regular intervals, because as the challenges are changing and evolving around us, we have to revisit how we address them. And that's the purpose of this discussion, and thank you very much for your support.
Thank you, Regional Director. Before concluding this rich discussion, I would like to consider the adoption of the proposed draft resolution contained in Euro/RC68 /conference document /10 revised 1, advancing public health for sustainable development in the WHO European region and its financial implications, contained in Euro/RC68 /17 add 1. Is the committee willing to adopt the proposed draft resolution? I see no objection. The resolution is therefore adopted.